This is task number 16. This is doing a TPR and oscillation on a cat. So I have my own personal cat here for the purposes of this video. And I don't have an assistant available to help me restrain, so I'm going to try to do him myself. That's usually what we end up doing in the exam rooms anyways when we're with the owners. Sometimes they help us, but usually if it's a good patient we can do the TPR ourselves. But if it becomes a problem, I'll go ahead and grab somebody to help me. But so basically when you're doing your TPR and your oscillation, checking in a patient, what I like to do is when the owner is talking to me, I have the patient out so that I can do a general overall observation kind of as they're talking. So we'll get the cat out of the carrier and let him hang out on the exam table. And that's where I can examine him to kind of see his mental status. Is he bright and alert? Is he look lethargic? Does he look sickly? Is he breathing hard? Does he just a general appearance of everything. So, but my cat here, he is bright, alert, and responsive. So I would chart his mental status as BAR. And then we can also look at the condition of their coat. Is it dry? Is it flaky? Do they have hair loss? How is the hair loss? Is it symmetrical? Is it down here? Do they have fleas? I always like to flea comb the patients when they come in. It helps them to feel better when you're combing them. A lot of them like it. And then also you can check for, it's a quick way to check for fleas too. So do they have hair loss? Things like that. So his hair coat, it's nice, smooth, shiny. There's no dryness, there's no flakiness, there's no alopecia showing. There's no mats or tangles, and it's not dull or shaggy or anything. So I would just mark his coat condition as looking very normal. So the other thing that we can look at is a body condition score. Are they overweight? Are they underweight? Do they have distended abdomens? Do they have any muscle wasting? You can look at things like that also while the patient is out. So if you see any of that, if you see any signs of obesity, or them having muscle wasting, or them having looking like they're underweight and malnourished, you can make notes of any of those. But my cat here, there's a few different ways of grading the body condition score. There's a 1 out of 5 scale, and then there's a 1 out of 9 scale. And him, you could tell he is very has a normal body condition score. He's not overweight. He's not too thin. His ribs are easily you can feel them easily. There's not a huge fat covering or anything, and but his belly doesn't stick out too much. So he's an average size. So I'd probably mark him like a 5 out of 9 on the 1 to 9 scale. So you can also look at their gait. Are they limping? Are they favoring one leg? Are they having a hard time getting up and down? Are they having problems jumping if they do happen to jump? Are they guarding anything? Do they seem guarded? Do they seem like they're in pain? All those types of things you can kind of gain from a distance without actually even really putting your hands on the patient. You can kind of just do that from observation purposes. And then you would also look at their posture. Are they hiding? Are they scared? Are they look like they're about to attack you? As far as staring you in the eye or seeming just different signs of aggression. And are they hunched over? Are they panting excessively? There's so many different signs of how you can tell if the animal's stressed, if the animal's painful, if the animal is aggressive, and I can go in depth of each one of those, but I'm not going to because it's just too involved. But the cat here, he's comfortable. He's rubbing up against me. He's purring. He's comfortable. His ears aren't down. He's not trying to hide. He's not trying to run away. And so for the video purposes, I would just note that he's calm and everything seems good with him. His posture's good. He's not hunched over. He's not guarding anything. He's not limping or anything like that. So when we begin our TPR, we can start with the gums. This is going to be an indicator of tissue perfusion. We want to make sure that the gums are a nice pink color. And if we see anything other than that, we definitely need to make a note of it. We need to, if it looks like they're jaundiced or yellow, that could be indication of disease. So we make a note of that. If they're cyanotic or blue, that's a sign of that the tissues are not being oxygenated properly, and so we need to make a note of that, and that's going to be an emergency. If they're pale, they could be anemic or have other issues, so we would make a note of that as well. But the normal appearance is going to be a pink mucous membrane. It's a nice pink color. And then we also want the gums to be nice and moist. If they're dry or tacky, we need to make a note of that also, because it could mean that they're dehydrated. And so let me make sure this is recording. Okay, good, it's recording. Okay, so what you can do to tell for that is you would just lift up the lip, and then so you could tell that his gums are pink. And then you could also check your CRT. You want your CRT, which is your capillary refill time, to be under 2 seconds. Anything prolonged could be an indicator that they have low blood pressure or whatnot. So what you would do is you would depress the gum and then let go, and then you count the seconds of how long it takes for that pink color to return. And so anything longer than 2 seconds could be an indication of disease, and anything faster, sometimes it does go really fast, but it could mean that they're really scared or they have high blood pressure. So you want to make a note of that as well. And then, so after you check the mucous membrane for checking for tissue perfusion, you can listen to the heart. So I have a stethoscope right here for that. Let me show you my tray of supplies too that I have. I have a stethoscope for listening to the heart and the lungs. I have a thermometer here with a new probe cover for taking the temp. I have loop for the thermometer cover. I have a calculator for calculating my heart rate and respiratory rate. And then I have the patient's chart right here with me. And then I have a scale too to weigh the patient as well. So like I said, we can listen to the heart. And there's 4 PMIs, points of maximum intensity. And I was taught a little trick that on the left side of the patient, you can put your hand like this. On cat, it's harder on cats because they're a little bit smaller. But there's 3 points of maximum intensity on a cat. Your pulmonary would be down here, your aorta would be up here, and then your mitral valve would be over here, and then your tricuspid would be on your right side over here. So when we're listening, we can listen for any murmurs, and then you could kind of tell where the murmur is originating from based on where you place your stethoscope of the PMIs. So we can go ahead and listen to the heart. So this is my pulmonary artery, pulmonary valve, and then you can move to the aortic, and then you can move to the mitral and listen for any abnormal lung heart sounds such as murmurs or arrhythmias. And then you can move over to the tricuspid, which is on the left side. And then also while you're doing this, you can oscillate for your heart rate, check your heart rate, and you can feel the femoral pulse back here. Are you gonna turn around and be all weird? So you put your hand on the femoral artery back here, and make sure that the pulse coincides with the heart rate. You don't want them to be out of sync with each other, which they are in sync with each other, so there's no indications of any problems. And I'm just going to look at the clock and count my heart rate for 10 seconds. I know, baby. Okay, so I got 32. So since I did it for 10 seconds, I would do 32 times 6. And so I got a heart rate of 192. So I would note that on the patient's record. And I didn't hear any murmurs, so I'll make a note of that as well. And I didn't hear any arrhythmias. And I'm also going to put that he's BAR and that his CRT was 1.5 seconds and that his mucous membranes are pink as well. Okay, so now also the normal heart rate for a cat is between 140 and 220. Sometimes when they're in the hospital they'll get a little bit more scared and nervous, so it might be above 220. So you need to be able to determine if it's just something of them being scared or whatnot from in the hospital. But sometimes I do get really high readings if they're very scared. Also, if dogs are really nervous too, the same thing happens. Okay. So the other thing is when you're feeling for the pulse back here, you can check the quality of it, if it seems like it's weak, if it seems like it's bounding, or if it seems like it's normal. This comes with a lot of practice because you have to be able to differentiate what is normal after you've felt a lot of different femoral pulses, because it could be different for each technician that does it. But I'm feeling the pulse right now, and to me it feels normal, and I'm pretty I feel these a lot because I monitor for surgery, and I'm always feeling my pulse quality during surgery. So to me this feels like a normal pulse. I can feel it easily, but it's not like bounding up against my fingers, so it feels normal to me. So the other thing that we can do is check his respiratory rate and the quality of his lung sounds. And so by that, I can listen to all the lung fields, which there's 9. So we'll start at the bottom, and we want to make sure that we're not hearing any crackles or wheezes that could indicate fluid in the lungs. Or some other type of congestion. And then you also want to make sure that you can hear air passing through each one of the fields. If there's if you don't hear air passing through one of the fields, that could be an indication of a problem. And then sometimes if they're purring, you're not able to hear it as well. So what I like to do is I'll put a cotton ball of alcohol in front of their nose just to make them stop purring. That way you can hear it better. Okay, so all of his lung fields sound good. Okay. And during that, I got a respiratory rate of 30. So what I did is I counted it over 10 seconds, his respiratory rate. And then so I just did it in my head. I times it by 10, and I got 30 for a respiratory rate. So I'll go ahead and write that down. Respiratory rate of 30. And the normal respiratory rate for cats is between 20 and 42. So you want to make sure they're not doing any open mouth breathing or anything lower or higher than that, because it could indicate a problem. So But he's also not having any abdominal breathing. He's not having any open mouth breathing, and he's not struggling or anything. So all of which those could indicate a problem. So his breathing is normal to me. So the last thing I could do is go ahead and check the temperature. So I use a new probe cover and I put some lubricant on it to help it to pass easier. And so okay, so I got 99.4. So I'll go ahead and chart that down. And the normal temperature is supposed to be 100 degrees to about 102.5. Anything higher or lower can indicate a problem. His is like 0.6 lower, but I don't think it's an issue. He's healthy. But I will make for a patient in the that I'd be checking in, I would be letting the doctor know that it was below the 100, or anything below that, or the 100, or above the 102.5. Above the 102.5 could indicate a fever of some sort, or it could be that they're nervous. So either way, you want to tell the doctor, because you don't know if it's them being nervous or scared or worked up, or if it's some kind of disease process happening with the patient. So either way, anything out of those normal limits, you want to let the doctor know. So also he's got up there so I can get his weight, which is 4.5 kgs. Good kitty. And that's pretty much the exam and TPR and oscillation on a cat.